everyone. Welcome to a brand new episode of BMC Global Life AL-HILAL Health World, Nothing But Lifestyle. I am Anupama Menon. Wishing all the viewers a very happy Diwali. May this festival of lights dispel all the darkness in your life and bring lots of prosperity, happiness and good health. October is known as the Pink Month. This is the Breast Cancer Awareness Month. Cancer is one of the most feared and dreaded diseases. And I'm sure many of us have come across cancer patients at some point or the other in life. And we have seen their journey, their struggle, the emotional toll that it takes, the pain. But the silver lining is that we have also seen lots of them bounce back from cancer and lead very normal and healthy lives later on. So the message is loud and clear. Cancer can be beaten with courage and strength, and yes, of course, timely medical intervention. Breast cancer is the most common and the most widespread of all the cancers all across the world. And when it comes to breast cancer, awareness and early detection goes a very long way in preventing it. So to throw more light on this topic of breast cancer, we're delighted to have with us today Dr. Maimoona Liaqat, consultant laparoscopic gynecologist from AL-HILAL Hospital, Muharraq. She comes with a wealth of experience. She has over 18 years of experience in the field of gynecology. Thank you so much for joining us, doctor, and welcome to the show.
Thank you so much, Anupama. You're welcome.
How are you doing today?
Alhamdulillah, think pink.
Yes,
already?
Both of us are in pink.
Already, yeah.
So, doctor, when we talk about breast cancer, as a layman, the first thing that comes to our mind is a lump in the breast. That's what we normally associate breast cancer with this.
Yeah.
So could you, for the benefit of the viewers, could you please explain in medical terms what exactly is breast cancer?
Okay. So you see, breast cancer, before knowing breast cancer, we have to know what cancer is. Cancer is the abnormal multiplication of cells anywhere in the body. So suppose when we are talking about breast, it has two parts which are more important. So there's a duct and there's a lobule. Lobule is the part which produces the milk, and duct is the part which pushes the milk inside the nipple. So usually the breast cancer, when they start happening, usually they can start either in the duct or the lobule. What happens is any cell, any normal cell can suddenly start going, bizarre, going crazy and start multiplying irregularly. When it's only multiplied there in the duct, we call it the ductal carcinoma. When it multiplies in the lobule, we call it the lobular carcinoma. So this is how medically we differentiate that what is a cancer, multiplication of the normal cells into abnormal, and then it continues to grow, and there are different stages which later on come in scene when you feel the lump.
Okay.
So it's not necessary to have a lump to be having a breast cancer. It can be without any lump, just some abnormal cells sitting there.
Okay, so it can be asymptomatic also.
Yes, yes.
Okay, so what are the basic signs and symptoms? What are the red flags that ladies should look out for when it comes to breast cancer?
So the biggest red flag is you're a lady. Being a woman is your highest risk of having a cancer. So it doesn't mean that men are safe. Like 1% of men also have to be worried. Oh, is it? Yeah, 1% of men do end up with breast cancer as well. Okay. But being female and growing old is the risk factor itself. Now when you talk about the red signs and the symptoms, normal women usually, when she's experiencing menstruation, should be careful about any sort of pain in breast. If she's doing regular examination, if she knows her breast, then if she finds something which is not normal like before, then that's alarming. If she finds change in color of the skin, if she finds there's any puckering or nipple is retracting inside, if she finds any lump in the breast or under the armpit, these are all signs and symptoms which are alarming that yes, go visit your doctor early. When it's spread, you start having vague problems. Like you may not know about your breast, you may end up having issues with your lungs, not breathing, any trouble with your tummy. Wherever it has gone, then you can have symptoms according to that. But we, in the month of October, are trying to encourage women to pick it up early so that it can be treated as soon as possible.
I guess women have to be more aware of their body, monitor themselves and look out for the signs.
Yeah.
Because early detection can prevent breast cancer to a great extent.
See, you must have noticed that there are so many cancers or, different type, but breast cancer has been dedicated a whole month.
Yes.
Not a day, not a week, a month. The reason is this, that in women, it's one of the commonest, as you've mentioned, 1 in 7 to 8 women will have a breast cancer. So you can imagine how common it is. So if we are at a risk of 1 in 7, we must be very, very careful and try to pick it up as soon as possible. So because it's treatable thing.
Yes.
This is not something that you will
it's
find out.
It's not the end of your life.
Yeah.
It's
if
just
you
a
find out,
phase.
you treat it, and that's it. You can spend the whole life beautifully.
Yes.
That's why.
Moving on, doctor, what are the different stages of breast cancer? Are there different levels, or how do you diagnose it?
So you see, Anupama, just like any cancer, it also has 0 to 5. So when we say 0, that is like basic, you have some abnormal cells sitting there, no problem. Then when you go to stage 1, then those cells multiply a little bit, okay, and cause a little bit of swelling in the local area. Then when you go to stage 2, the size increases between 20 to 50 millimeters. It can be 20 to 50 millimeters with some lumps or lymph nodes involved under armpit, or it could be more than 50 millimeter without any lymph nodes. You go to stage 4, okay, in that one, the size would be more than 50 with a lot of lymph nodes, or the skin or the deeper muscle could be involved. And then the last stage is metastasis. That means it must have been passed out anywhere in the body. It's spread to the body.
Complete body. Okay.
So this is how we grade it, whenever the patient is coming, we stage it, and at what stage is it, and what treatment is the best for her.
And what are the tests that you normally advise to diagnose breast cancer? Mammogram is something which a lot of us are familiar with. Are there any other tests involved?
Definitely. So there are two things. One is screening, one is diagnosing. So presently we are going to talk about diagnosing. So for diagnosing, definitely number 1, mammogram is a screening test. It doesn't help in diagnosing. Breast lump biopsy is the main way to diagnose a cancer. So mammogram is not diagnostic. Again, I want to explain this clearly, that mammogram is a screening test. So when we are telling everyone that get your mammogram done, this does not mean that, okay, if it has picked up something, for sure it's going to be a cancer. It is just screening. You will say it's a cancer after you take a biopsy and confirm the cell of cancer sitting there.
Okay. So first screening, as part of screening, we'll have to go in for a mammogram.
Yeah.
And then biopsy is the test which is conducted to confirm the presence of malignancy.
Yeah. So because you asked about diagnosis, I told you about the diagnostic test. But when we are going to be screening, we have a lot of ways. See, there are groups of screening. Young girls who are maybe starting from 18, we encourage from 18 onwards. So 18, because see, cervical cancer screening starts from 25 in UK guidelines and all, but we are encouraging girls, as soon as they become sexually active, they should go for cervical screening as well. And along with that, for breast screening from 18 onwards, they should be able to do self-home examination. This is not going to pick up the diagnosis. This is not going to reduce the mortality rate of breast cancer, but what it will do is it's going to let you know about your own breast, how it is. So when you know yourself, whenever you'll find something abnormal, you will definitely immediately visit and earlier be detected. Do you get it? So from the 18 onwards, we tell them home
test,
self-test.
Yes.
Then when they reach the age of, if you're at high risk or low risk category, even low risk or high risk, we have to be sure to encourage them to come once in a while to doctor if they find something. But in high risk patient, definitely after the age of 40, we have to be more alert. So there are different guidelines for patients. After the age of 40, some people say that annual mammogram is recommended, whereas some guidelines like UK and American, and there are so many guidelines, Australia has different, some say no, it's 2 yearly. So from my side, what I say is, because in Bahrain, it's very, very high, and I've seen families affected, the whole families, like mother, her 3 daughters, all of them BRCA positive. So I recommend that it's better if you especially have high risk and you have family history, go for yearly mammogram after the age of 40.
So is this hereditary, is it passed on, the genes passed on from the mother to the daughter, and if somebody in your family has breast cancer, does that mean that you have a higher chance of contracting it some point or the other?
See, interestingly, this is like, fear factor for people. People
Yes.
think that, oh, because there's a cancer in family. Actually, it's not like that. Only 5 to 8%, maximum 10% of cancers are hereditary, genetic.
Okay.
They are not going to run in your family other than those 10%. So, for example, if in your family you have more than 2 people, and they're first degree contacts, like, your mother, your sister, the first degree,
okay.
then yes, definitely you have to be high alert and get yourself examined as a screening for BRCA genes. So BRCA1 and BRCA2, if you're positive for those, then that means yes, this runs in your family, and your risk of having a breast cancer is higher than the normal.
Okay, so you spoke about BRCA gene. So what kind of a test? Is it a blood test that you do to find out whether you're carrying that gene?
Yeah, BRCA gene is a blood test.
Okay.
Definitely it's expensive, and that's why usually people are hesitant to get it done. But if it is running in your family, it is advised. I can give you a very simple example of Angelina Jolie.
Yes.
We know.
Yep.
She found out, she did her BRCA, she was positive, and she got her breast removed. She got her prophylactic mastectomy done. It's like a way of treating yourself before the disease occurs. So you're at high risk. There's 60 to 80% chance that you will develop the breast cancer. So why not remove that part where you're going to have the cancer? So she removed her breast, and then this is how you can do for ovaries as well with the BRCA genes positive. If you know you're at high risk, you can remove your ovaries before time.
Okay. And and what about mastectomy? When is that recommended? Is that as a final resort or in the initial stages, like you spoke about Angelina Jolie now? So even though she had not, she was not having cancer as such, it was done as a preventive measure. So in the course of treatment, where does mastectomy stand?
So you see, usually when we are staging the patient, in the staging, as I said, in the first 3 stages, usually it is localized, it is just within the breast. It depends on the size of the tumor, the size of the breast, and then you can see that should you remove the whole breast, or is it just the mass which should be removed. So it varies from person to person. Now we are talking about someone who's affected, who has a lump. Should we go for lumpectomy or mastectomy?
Okay.
So in that, definitely up till stage 3, we have to balance whether the size of lump is bigger than the whole breast, or is it such small that we can remove the lump and the breast is healthy.
So lumpectomy means just the removal of the lump,
mass,
the rest of the breast is maintained as it is.
And if suppose the lump is big, and then we have feeling that no, when we remove it and there may be some chance something left over, better to do mastectomy. Similarly, that when we are talking about prophylactic high risk patients, as we said, the patients who have family history, gene positive, they have any mother, sister, anyone who had breast cancer. If someone is coming in with history of small breast cancer, recovered, again she comes in, then we do the mastectomy in such patients. So prophylactically it's different, and therapeutically it's different.
Okay. And does breast cancer spread very fast to other organs? Because as far as we know, it's one of the safest cancers maybe amongst all the cancers. But what is the rate at which it spreads to other organs?
See, it's not very fast. But the problem is if it's not picked up earlier, like we say, because as I said, in the stage 4, it'll go to the skin and the deeper muscle. And in the stage 5, it goes all over the body. So it's at which stage are you picking it up? When are you diagnosing it? Usually the breast cancer doubles in the size in over 6 months, 180 days.
Okay.
So whatever the size is, it's going to double in 6 months.
Okay.
So this is how it's going to spread. Now it is fast or not, you can check yourself that as soon as you find out, you have this time period to immediately start the treatment. This is how it will spread.
And what are the side effects of the treatment? Let's say somebody has to go in for mastectomy or maybe a chemo or radiation. So how does it affect that person physically? What are the side effects?
See, breast cancer itself is not something, how should I say, it's not just a disease itself. It is going to be affecting you in different ways.
Yes.
Your physical health, your mental health, your psychological health, your relationship with your family. Everything becomes like, oh my God, just imagine yourself one day hearing a word, you have a cancer, breast cancer. Your whole life turns upside down. So in that case, when we are saying that, it's how it affects or what it's going to do, we have to be prepared. First, patient has to accept it and then go for the further treatments. Now,
I think family support is also very essential.
The most important thing, a patient can only come out of cancer healthy if you have a strong support. And not just family, your work support, your friends support, your kids support.
Yes.
My God, I cannot emphasize on this fact that any patient suffering from cancer can be saved by your kindness towards them, your support to them. No matter how much struggle they'll go through, if they know there's someone behind them, they'll come out of it.
Doctor, talking about screening, is MRI also a part of the screening process?
See, MRI has been used in some of the patients. Yes, it has been considered as screening, but not like mammogram. Definitely the information you get from mammogram is way, way better than going for MRI. But there are some lesions in which MRI is also helpful.
Okay.
When we tell the patients to go ahead do the screening with mammogram, as I said, after the age of 40, some places is considered 50, but they say annual checkup. But as the age increases, your risk of cancer goes high, especially after the age of 70 onwards. So we have to remember that we don't tell patients that at the age of 50 or 65, once they're menopausal, go home, sit down. No. Menopause does not stop your risk. You still have to continue your mammogram in your annual checkup, even after the age of 70.
So how often would you suggest for high-risk patients, let's say there's a family history or they're above 40, how often do you think somebody should do a mammogram? Yearly basis? Once a year is enough?
It's very important yearly, especially high-risk groups, In low risk, you can sometimes tell them for 2 years, up till the age of 45. Some people even till the age of 50. They say that 2 years for mammogram from 40 onwards. But if high risk group, definitely do it yearly after the age of 40.
So youngsters are not very prone to this, right? Because we hardly hear of teenagers or ladies in their 20s and 30s getting breast cancer.
Yeah. See, youngsters, if you know that in your family someone had a cancer, at what age did they have it? For example, one of my patients, her mother got it at 35 years. So for her, we started screening earlier. From the age of 30 onwards, we did regular ultrasounds. And when you suspect something, go for mammogram after the age of 35 also. Even at young age, mammogram is not dangerous. People are very scared that mammogram itself may cause damage and create a cancer. Once a while, mammogram is not going to be very dangerous for you rather than picking up the cancer. So if you're high risk, please don't ignore. Do the mammogram if required and suggested by your doctor.
And doctor, there are some myths surrounding breast cancer, like you mentioned about mammogram. Some people are worried that mammogram itself may lead to cancer, or maybe excessive use of deodorants or wearing tight fitting clothes. So if you could dispel some of the common myths that you have observed in your
So this is one of the most interesting part. Patient come, they have very, very interesting questions, and like I can understand. So women come in saying that we are wearing tight bras, can that cause cancer? No. Women having one big breast, one small breast, can that be cancer? No. Unless there's some problem like after checkup, no. That's normal for one breast to be bigger and one smaller. Similarly, deodorants or perfumes, no, they don't. Holding mobile, keeping laptops on your chest, no. So there are so many.
But still, it's not advised.
Yeah,
Laptop
not advised.
and mobiles, yeah.
Yeah, but OCPs, this is one of a very, very interesting question. Patient says that oral contraceptive pills. See, oral contraceptive pills are very good contraception. If you're low risk, you don't have any other problems. Before the age of 35, beautiful. After the age of 35, definitely recommended, but the continuous long-term use, for example, someone is on oral contraceptive pills for around 10 years plus, then your risk of breast cancer may rise a little bit. It's still not very high. We have to manage the pros and cons of getting pregnant or having, the tiny risk. I would suggest that when you take long term, always follow up with your doctor, and you can take a break in the middle for a while, 1 year. Whenever you stop the pills, your breast cancer risk goes back to normal. Again, when you start, then again it's something new. So you can stop it and then restart them.
So viewers, we'll slip into a short break. Don't go anywhere. We'll be right back and we'll discuss more about the treatment options and the side effects and the various myths about breast cancer. We'll be back in a while. Welcome back everyone. Doctor, moving further, could you please tell the viewers about the various treatment options available for breast cancer?
Okay. So once patient is diagnosed and she accepts and understands, according to her staging, we give her the options of treatment. The treatment is definitely, if there is a lump and it's localized, we do a lumpectomy. If it's a bigger lump, but still contained in the breast itself, then we ask for a surgical treatment with mastectomy. And some patients, if they have advanced cancer, then for them chemotherapy and radiotherapy is more of benefit. So any patient having any sort of breast cancer according to the stage will be treated. Any patient with early breast cancer will be given at least 3 to 6 months of chemo. So if it's stage 1, 2, 3, 3 to 6 is more than enough with chemo. But suppose if patient has more advanced cancer, then the chemo may have to go more than 6 months onwards according to patient.
So doctor, chemo is a very scary word. When we think of chemo, the first thing that comes to our minds is loss of hair and vomiting. It can be a very emotionally trying process. Yeah. So does this happen to all the patients? And what are the normal side effects of chemo treatment, chemo and radiation?
So as you said that it is a scary thing, definitely when patients just hear the word chemo, the first thing which comes to their mind is the hair loss.
Hair loss, yes.
Yes, definitely. Most of the chemo drugs have this side effect. They don't only affect on the cancer cells, they start affecting your normal cells as well. So all the normal cells also start dying for the time being when you're on chemo. They can affect your blood cells, you can end up having a lot of sore throats, you can end up having a lot of infections, bleeds, hair loss, loose motions. All of these are side effects of chemo. But then again, it's according to the immunity of patient as well, and the stage of patient, and the dose being given. So we cannot say which patient will have more side effect, who will respond better, but we have to prepare them that these are common side effects, these things can happen in you. So, honesty is the best policy. I guess that we should always be honest with our patients, especially in cases when we are going ahead and proceeding with such invasive, chemotherapy or radiotherapy or procedures like this.
So it's better that the patient knows exactly what to expect, the awareness
because
is important.
Once you can imagine ourselves, when we accept something, we don't
it's
complain
easier to
much.
deal with it.
It's easier.
Yes.
But when you're not prepared and this happens, most of the patient will stop in the middle. Mm-hmm. They won't be able to complete their sessions. So when they know, okay, they have to go through this, it may be a long procedure, may be very, difficult for them, but they have the support of family. They have people with them, taking their back. And any cancer can be beaten with a positive thinking. If you are looking at it, yes, I will come out of it, you will come out of it. But if you are in the beginning, oh, it's a cancer, no one survives, no one, your body also starts losing its immunity. Indirectly, somehow it affects you and your response to medicine becomes slower. So the positive thinking is very, very important for any patient. When they're in cancer, they have to know that they will be okay, they can survive. with the worst condition also. Breast cancer is something very lovely because if it is local and you remove it, the survival rate is like 85%. And if suppose there was just a small lump, you remove the whole of it, then it's 99%. So it's not very bad. But even with advanced stage, we do not tell patients to lose hope that, definitely, after metastasis, there is no chance. No, chemo and radio can do miracles. There are so many drugs which can, the cancer cells start dying themselves inside. So we keep our hopes up. We give the patient hope, positive approach, giving them all honest answers, and hopefully they should be making the day, the month,
bounce back to
life.
a normal life.
Yeah.
Normal, healthy life may be much better than before as well. Yes.
And you have seen that cancer survivors, they are no more scared of anything.
Yes. Because they've been through so much, so
It's
they're
so
ready
strong.
to face
They come
anything in
out
life.
Stronger.
Yes.
And they give us hope more. Like I have talked to them, I've taken their interviews. I cannot tell you that how passionate now they are about their life, whatever they're doing in life, because it's like they got another chance and they don't want to waste it. So
they know how to live life to the fullest after a cancer treatment. So doctor, what are the risk factors associated with breast cancer?
In risk factors, there are very, very important things a woman should know, that any condition in which your estrogen levels go high are going to be causing your breast cancers. Now, which are the condition in which you have? Any patient who's obese, because the extra fat cells, they produce estrogen and they again multiply the lining of your womb and your breast. Again, a woman who starts her periods at a young age and finishes them at a late age, that means she had more periods, that means she had more estrogen during her life. Any patient who is infertile, that means she did not get baby. When you don't get pregnant, because in pregnancy you have 9 months of no periods. But when you don't get pregnant, obviously you are having more hormones exposure, more estrogen. Again, any patient who's not breastfeeding, because breastfeeding again protects you from estrogen. You don't get your periods regular. So during that time, again, your exposure to estrogen goes low. So all these conditions, not all the cancers are related to estrogen, but most of them are hormone based. So any patients with all these risk factors are more at risk for having breast cancers. Again, when we talk about OCPs, oral contraceptive pills, definitely they have estrogen in it. If you stay long term on it, then maybe your tiny risk may go up. But it doesn't mean that you don't take risk OCPs just considering no, it can increase breast risk. No. Breast cancer is increased if you use it for maybe 10, 15 years, continuous OCPs. So no problem. And then again, then are the things which are secondary, like we talked about genetic, which is only 5 to 10% of cases, lifestyle, sedentary
you spoke
lifestyle.
About obesity just now. So is it also linked to your lifestyle habits?
Definitely.
Sedentary lifestyle. And
Definitely.
what about the diet, your diet intake, junk food? Does it contribute towards breast cancer?
When we are encouraging patients to prevent breast cancer, what are we telling patients? All these factors, sitting, not working out, gaining weight. Obviously, when you're not going to be active, you'll gain weight. Smoking and alcohol directly, and high intake of caffeine. All these are the things in your routine which are going to affect you. So how do we prevent them? Comes the part, okay, what are the things we can do at home? So you need to know your risk factor. I need to know my risk factor. Suppose I'm overweight, I need to cut down on my weight. How do we do that? Anyone working out for 30 minutes a day, 30 minutes walk, brisk walk, can reduce your risk of breast cancer 40% down. That's a very, very amazing result.
Yes.
So even if you can't do 30 minutes, 11 minutes walk, every day brisk walk, 11 minutes can reduce 18% of your risk of breast cancer.
So exercise is very important.
Very important. Coming to your diet. So definitely this is an era of, fast food. And unfortunately, if you see that the way they bring in, how do you get these beautiful chickens every day? Do you see these, when you go to buy the chunky pieces, They're not beautiful because they're organic. They're beautiful because they have been injected with hormones. To grow fast, because they need to bring it out. So all the product we are eating is not organic or healthy. The reason for young girls having early puberty, you have seen young girls having breast ending up with very early menopause, puberty periods. This is all because of our food habits. Next, coming to, so when we try to switch to food habits, please, organic foods. If you can get a chicken in your home, get eggs made in the home. Perfect. That's the only way I think organic is possible.
Yes.
Then after that, when you're eating food, try to avoid red meat a lot. Switch to turkey, white meat, fish, turkey. They're very good. Grilled food is better.
Red meat ideally to be avoided.
Yes, avoided. And then when you're taking the oils, definitely omega oils, olive oils, there are some seeds which are present everywhere generally. So chia seeds are said to reduce the risk of breast cancer very nicely. Using them routinely in your food is good. Then fiber diet, amazing, please. Put in fruits, put in vegetables, put in smoothies. Take all the green things, put them inside the machine, blend them up and drink it up. So smoothies, green vegetable, they're very good. So because they're all antioxidant. Antioxidant means they basically don't let the cancer cells multiply a lot or go abnormal. So antioxidants in your lifestyle, when you're taking water, you can put lemon, you can put oranges inside. They have antioxidants. So these are some of the changes you can make in your food. Then coming back to exercise we have done, smoking.
Yes.
Smoking is not a healthy habit, not cool. I don't know, for youngster it may, now the vape is going on. Vape is also being diagnosed with having cancers. Shisha itself, because I've seen families, the trend of families sitting having shisha. It's not only affecting you but your kids as well. So all these type, alcohol, zero alcohol. I mean, it's not, alcohol is directly related to cancer. So smoking indirectly can when you're a heavy smoker, but alcohol is directly related to your cancer. So definitely please stop smoking and yeah, that's right.
I'm sure this will serve as a wake-up call for all our viewers out there, who've been taking their health lightly. So exercise and a healthy lifestyle, a healthy diet, I think will go a long way in preventing cancer. Good to know that. Doctor, before we wrap up, could you please explain to our viewers in a nutshell the points that we discussed today and a few tips to prevent breast cancer and how to overcome it?
All right. So breast cancer is a cancer which can be taken over. We can beat it together. So please, screening is important. Check yourself. Inform others. The important thing is it's not only your life, people around you. Talk to your mothers, your father, even men. So please don't think that I'm talking to women. It's about men, everyone around. Inform each other. The whole month there are different places with different packages. Go ahead. We have 50% off on mammogram as well. So you should go ahead. If you're more than 40, come for mammogram. If you're less than that and you have high risk, you have family history, come to doctor and ask, do you need any screening method or not? Then know yourself, your body. What are the risk factors in you? If you're obese, cut down on your weight. You're smoking, cut down smoking. You drink alcohol, please, no alcohol. Or even if you want to manage what type of alcohol you're taking, how much you're taking, please have a look into it. Your diet, please, high fiber diet, low carbs. Improve to your oils. Move to the olive oil instead of the normal routine things. And running, jogging, very important. That's it. I think most of the things are covered here. If any questions, please do visit us. And stay safe. Pink, we both are representing beautifully.
Pink, yes.
So all of you, enjoy the month of pink, and anything at all, please visit us. Thank you.
Thank you so much, Doctor, for taking the time out and for patiently answering all our queries. I'm sure your talk has been an eye-opener for a lot of our viewers, and it's dispelled also a lot of myths about cancer. So thank you so much once again.
You're welcome. Thank you.
To all the viewers out there, Please make your health a priority. If you find any early symptoms of breast cancer, don't hesitate to visit the doctor. Please do get regular mammograms done. As Dr. rightly mentioned, cancer can be beaten with a positive attitude and with the support of your family and friends. So stay healthy and happy always. This is Anupama signing off till we meet again next time. Good night and stay healthy.